In this video, I want to talk about what to expect on the day of your thyroid surgery. Thyroid surgery is usually recommended to remove an abnormal growth or nodule in the thyroid gland. Another reason we sometimes recommend thyroid removal is if you're having compressive symptoms, or symptoms from an abnormally large thyroid pushing on other structures in your neck. These can include a sensation of fullness, trouble swallowing, or even breathing problems. So, what to expect the day of surgery? Thyroid surgery is done in an operating room, either at a surgery center or a hospital. On the day of surgery, you'll report to the facility where your surgery is scheduled. You'll get checked in and be brought to the preoperative area. There, a nurse will review your health history, ask routine questions, check your vital signs, and place an IV. That IV is how you'll receive fluids and medications before and during surgery. Next, your surgeon will come visit with you to confirm the plan, answer any questions, and review any concerns that you may have. The anesthesia provider will also meet with you to discuss the anesthesia, what it will feel like as you go to sleep, and what to expect as you wake up. You'll be able to ask them questions as well. After that, you'll be taken back to the operating room. You'll move yourself onto the operating table, get positioned comfortably, and breathe oxygen through a mask. You'll then receive medication through the IV and fall asleep. Once you're asleep, the anesthesia provider will place a breathing tube through the vocal cords. This tube has a small balloon that sits just below the vocal cords and protects your airway during surgery by keeping saliva and fluids from going down into the lungs. For many thyroid surgeries, a special nerve monitoring breathing tube is used. This helps your surgeon monitor the nerve that controls the vocal cords, called the recurrent laryngeal nerve, while the procedure is being performed. Once you're safely asleep, your neck is cleaned with a surgical prep solution and you're covered with sterile drapes. You'll often have a small support under your shoulders to gently extend the neck, which helps provide access during the surgery. Your surgeon will then make an incision in the lower front part of the neck. The length of the incision can vary depending on factors like the size of the thyroid and the specific surgery being performed. The surgeon will remove either one side of the thyroid, known as a lobectomy, or the entire gland, called a total thyroidectomy, depending on what was discussed with you before surgery. After the thyroid is removed, the incision is closed in layers with dissolvable sutures. The top layer is typically covered with either skin glue or sterile adhesive strips. When the surgery is finished, you'll begin to wake up. The anesthesia provider will remove the breathing tube once they feel it's safe, and you'll be taken to the recovery area. In recovery, the nursing team will monitor you closely as you fully wake up from anesthesia. Once you're stable and doing well, you'll be reunited with your family. While you're in recovery, your surgeon will usually speak with your family to let them know how things went and to review any instructions for the recovery period. Then once you're ready, you'll be reunited with your family. While most people go home the day of surgery, occasionally your surgeon may request you stay overnight in the hospital. Typically, this plan is discussed with you before surgery. If you're heading home the same day, the nursing staff will give you written discharge instructions, and you'll be able to go home. So, what medications will you need? Medication plans are usually discussed before surgery, but here's the typical approach. For pain, most patients do well with medications like Tylenol and or ibuprofen, depending on what your surgeon recommends. You may also receive a prescription for a stronger pain medication to use as needed. If you had a total thyroidectomy, you will typically need thyroid hormone replacement afterward. If you had only part of the thyroid removed, you may or may not need thyroid medication, depending on your labs and your surgeon's plan. Either way, follow your surgeon's specific instructions. And that's what to expect for thyroid surgery. Now you know. Thanks for watching.